Hello, I'm Professor Mohamed Khadra and I'm pleased to present you this video on trans-urethral resection of a bladder tumour. The aim of this video is to help you understand the operation, its main side effects, and to prepare you better for your upcoming procedure. This video is intended to be used in conjunction with the information leaflets you've been provided. The procedure involves placing a scope, which is called a cystoscope, into the bladder, and this allows us then to access the tumour that we find in the bladder and remove it completely. The tumour fragments are removed using suction and sent to pathology for analysis. This is to know how deep or superficial the bladder tumour is. You will usually be given injectable antibiotics before the procedure after checking for any allergies. Make sure you inform us of any blood thinning medications or conditions that may affect how we perform the procedure and how you will heal after the procedure. A full general anaesthetic is normally used and you'll be asleep throughout the procedure. If you have any allergies, be sure to let the anaesthetist know. A different type of anaesthetic may be used depending on the anaesthetist. A bladder catheter is usually put in after the procedure. Most procedures have side effects, and these range from very common ones to more rare occurrences. But in most cases, patients go through the procedure without any serious side effects. Some side effects include mild burning or bleeding on passing urine for a short period after the procedure. This can go on for at least 6 weeks. Sometimes, once we see the pathology, there is a need for additional treatments to the bladder to prevent later recurrence of the tumours. Occasionally, there are infections that can occur in the bladder and these may need antibiotics. Recurrence of the bladder tumour is either because the tumour itself was incompletely removed or the tumour itself has seeded in the bladder again, and that's why it's important to have a look in your bladder at a later stage. Delayed bleeding needing removal of clots or further surgery, damage to the drainage tubes from the bladder, which are called the ureters, needing additional therapy, injury to the urethra causing delayed scar formation, perforation of the bladder needing a temporary urinary catheter or open surgical repair. The general side effects include the risk of general anaesthesia and possible heart and lung complications. Hospital-acquired infections can occur in about 1% of patients. Formation of blood clots in the legs and lungs is uncommon but can occur, and we certainly encourage you to move your legs and return to walking as soon as possible to prevent the formation of blood clots. Your anaesthetist will discuss this in more detail. It usually takes about 2 to 4 weeks before we get the biopsy results from the tissue we removed during your operation. This allows us to determine whether there's further treatment needed. Please contact my rooms as soon as you get out of hospital for an appointment for this to be discussed. After any surgical procedure, there are known side effects. But if you're concerned or the side effect is unexpected, please don't hesitate to contact my rooms or present yourself to the nearest emergency department. Hopefully, this video has presented you with an overview of the procedure. You will have already received the patient information booklet, and we've had discussions during our consultations. If you have any questions about any of the contents of this video or the information sheets you've received, then please don't hesitate to contact the practice or to make another appointment before your operation.